And so they do have tests to give out to residents of the county. Anybody can go, but it's one per person per household, for each member of the household, and you call ahead. They're trying to limit personal contact.
Which probably said it there. Also, with that, I think you can go to the South Dakota Department of Health website and order them also. Individuals can. We'll tell you these tests are just as accurate as what you're going to get. So they're the same test that they're using. If you use them correctly, I will add that. I will make sure you follow the directions.
Once they have a story.
Oh, Lee, you're back in time for the pledge. There's always an underlying something on them. I'm sure you don't. Okay, it is 9 a.m. I'm going to call this meeting of the Codington County Board of Commissioners to order. It is Tuesday, February 1st, 2022. We'll start with the pledge, and Commissioner Gable, would you lead us today, please?
Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you for that. I would just add, if you have a cell phone, if you could silence it, if you need to take a call, if you could step out. Also, we are streaming live on YouTube. Item number 2, call for public comment. We will still accept calls from the public, excuse me. The 2 phone numbers are 882-6248 or 882-6297. And those are items that are not on the agenda for information only, and we will address those during the open part of our meeting. Item number 3, conflict of interest items. Are there any on the agenda for fellow commissioners?
Nope.
None.
Nope.
All right, item number 4, action to approve the February 1st, 2022
So
agenda.
moved.
Motion
Second.
by Van Dusen, second by Gable. All in favor, say aye.
Aye.
Opposed, that motion carries. Item number 5, action to approve the January 25th, 2022 minutes of the Board of Connington County Commissioners.
So moved.
Motion by Johnson, second by Gable. Any additions or corrections? Not hearing any. All in favor, say aye.
Aye.
Opposed, that motion carries. Monthly reports, we will start with extension with Jody.
Morning, Jody.
Barely
Good
gave you a
morning,
chance to
Jody.
catch your breath. Yeah, it's crazy up there.
The building still standing over there?
What that?
Is the building still standing over there with the wind out of the northwest?
I don't know. Probably. Well, in January, one of our 4-Hers attended the National Denver contest and the CDM Skillthon. I don't remember if I said this last month, but she was going there then, but their team placed 2nd in the nation there in the CDM Skillthon, so Allison Fisher. So congratulations to her, and she just went right from Denver back to college at Spearfish.
Yeah,
Spearfish.
yeah.
Spearfish. So she didn't come back to the east side that day. Farm show is next week. 4-H will have 2 lunch counters this year. We'll be serving coffee rolls in the field house along with meals to go to them that are in the field house. We just can't find enough volunteers to cover all that, along with the shortage of Coke coolers to go with it. So we did just fix one of our coolers. Had someone come in and he did fix one of our coolers that we had that was down. So we're happy for that. We did have and I have 3 overall chairs that are helping with that lunch counter. 5 of our 4-H leaders took on the task of coming up with allowing our 4-H exhibits back in the field house. So those will be in kind of a booth style place over there. So they'll be bringing those in on Saturday. So that will be new because it hasn't been there for a while. There'll still be photography and quilts for the open, but this will be for the Connington County 4-Hers for this year. Shooting sports is going well with archery and BB gun and air pistol and air rifle going Tuesdays and Thursday nights. The Northeast 4-H advisors are planning a regional 4-H teen series. Our first one will be March 5th, and we're going to host that at Lake Area Technical College as our building is being used. So this is part of our Vision 2025, and we did receive a $1,200 grant from the South Dakota 4-H Leaders Association for that, and we'll be doing virtual kid care again too for kids in this area also. So that'll be coming up also in April, May, probably. And then I took a class for renewing my teaching certificate yet, and it was the positive shift, and my coworker took it also. And our goal was to share that book, and it was called The Positive Shift. And we were going to do a book read with our South Dakota Association of 4-H professionals, and we opened it up to other states. So we have 58 attendees. They're going to be joining us via Zoom
Wow.
for our book read from North Dakota, Iowa, South Dakota, and Kansas. So we start that next week. So since it was so big, we're going to have 2 of them. So we're going to host a 10 o'clock and a 1 o'clock Zoom for that. So
That's exciting.
yeah, so we're really excited about it. What's that?
How long will that
We'll have one in February, one in March, one in April, and then we're going to finalize it in May at our spring conference. So to break up the book a little bit. So excited to share that with them.
Yeah.
So, any questions? We'll be at the farm show next week and hope everything goes well. So
Yes.
it's just every year is different. So trying to plan and know how much to buy is.
Hopefully it'll be
Yes.
busier this year.
Yeah.
Yeah.
Things are settling down a little bit.
Yep.
Booths are back, so.
Yeah.
Booths are back,
To
yeah.
normal.
A little bit. Yeah.
Mhm.
All
That's
right.
great.
Thank you.
Thank you. All right, then let's move on to Veteran Service Officer with Todd. Good morning, Todd.
Good morning.
Morning, Todd.
Morning. So we had 2 DAV transports in January, one currently scheduled for February. Received an email from the state DAV headquarters that stated our DAV van was being picked up by the VA from their national headquarters on 3 February. So it's getting closer. As far as the Explorer, I just took that over to get a few repairs done on that. Have the oil changed, a couple wipers fixed, light bulb, stuff like that. So it should be as good as it can be when it gets turned over to the county. I did happen to speak with the county coroner and mentioned that we might have a vehicle there that he might be able to. I saw some stuff in the notes earlier and I just quick discussion with him and I said, well, that might be a possibility. So just food for thought on that.
Yeah.
I met with Terry Hoffman with the Community Transit last week to discuss a new grant that they had received. Rides to Wellness is what they're calling the grant. Basically, we just kind of talked what it could offer the veterans, giving veterans ride to VA appointments. I'm all for it. I thought it sounds like a good deal to me. We're going to work out some of maybe the processing, how that's going to work. You know, if veterans call me, veterans call them, some stuff we still need to work out, but I mean, I think it's a great deal. And we'll just have to kind of see, I think from a standpoint that, you know, we do have a new DAV vehicle and how this all goes together. I don't know a lot of history as far as at one time we had 2 vehicles here and they said, well, you're not using it enough. They took one away. I don't know exactly, but we'll see how that goes down the road.
So would these appointments be within Watertown? Or would these even be some down to Sioux Falls?
I would say when we talked, he said that they would take them to Sioux Falls, you know, and stuff like that. So
Are they gonna wait for them though?
yes. And if they have to stay overnight, he said that they would come back the next day. So
Oh.
kind of I mean, we should be able to work and accommodate a lot of veterans from that standpoint, either
That was
him
one of
or
the-
us.
One of the things that I know the drivers didn't like, you know, someone had to be down there for a 9 o'clock appointment. And they had to sit and wait till 4 in the afternoon to bring them back. You know,
Yeah, I understand that, but you know, that's what he said. So we'll
Yeah.
be able to work that out.
that'd be good.
You were meaning previous to this, you were meaning the DAV drivers, right?
Yeah.
Through the Veterans Office, yeah, okay.
So another little interesting note here is I reached out to Chief Toomey and Sheriff Howell regarding disabled veteran plates are legal to park in disabled person's parking spot. Chief Toomey responded, and I quote from his email that he sent back. He said, "I researched the state law and we spoke with the DNR. Their opinion is yes, a DV plate is sufficient to park in a handicapped spot. The law specifically states the special plate shall be designed to readily apprise law enforcement officers of the fact that the motor vehicle is owned, operated, or in use transporting a person with a substantial physical disability. Additionally, our ordinance for handicap parking recognizes special license plates. So it is in fact for a veteran with a disabled veteran plate to park in a handicapped spot." And he had included City Attorney Matt Roby, and he concurred with Chief Toomey's research and answers. So it was a discussion in one of my amongst the VSOs on a state call in, and I said, "Wow, that's interesting." So I just kind of got it confirmed. So before I put anything in.
So on those veterans plates, that writing's pretty small. It says disabled. It's not like like a normal disabled plate. It's pretty clear,
But there's certain ones that, like you can have a combat veteran or.
Right. I'm just saying that those are kind of, that the writing on that is.
Oh, yes.
Get kind of close to the plate to read it, so that's.
So it's
that's all.
not
But it does
all,
say it.
yeah, it's not
It's-
all veterans plates, it's specifically
Yeah, I would say,
disabled.
yeah, there's
veterans.
different, it's
Yep.
different
It-
categories.
Then there's different requirements for a veteran plate as opposed to a disabled veteran plate. In the future, I am off next week for a little R&R. Peg will be in the office all week, keeping things going. We continue to digitize our records and updating our database. We have noticed over the years different codes and how data entry has changed. This will be a long-term issue, and we are trying a little bit at a time. They built a database, so you try to go in and run a report to see who's on pension and in the county, and I get like 500 names, and I know it's not accurate. It's just the way that they entered the code. So that'll be an ongoing thing, just being aware of that stuff. But we are making good progress and getting everything online and digitized. So if there's not any questions, that's all I have.
Very good.
Hey,
Anyone have
Todd?
any questions?
Okay, have a good day.
Have a
Thanks,
good week.
Todd.
Have a good trip or whatever your time off.
All right, item number 7, action to approve a Rangeland Fire Assistance Resolution. And we received that information. Cindy, did you want to add anything to that as well?
Nope, it's pretty self-explanatory according by the letter that we received. We just need to update our information to change the emergency management director from Jamie to Andrew.
I'll make a motion to approve.
All right, motion by Van Duzen, second by Waterman. Any other questions or comments on that? Hearing none, all in favor, say aye.
Aye.
Opposed, that motion carries. Item number 8, action to approve a second amendment to the FY22 WIC clerical contract.
And we had an amendment earlier or several months ago. And this just reflects the time period changes. It does not affect our contract. The last amendment took effect October 1st. So this amendment goes from October 1st through May 31st, which is our normal year end. So
Move to
it's,
approve.
yep, it's just a technicality.
I'll
All right,
second.
motion by Johnson, second by Gable. Any questions or comments on that? Hearing none, all in favor, say aye.
Aye.
Opposed, that motion carries. Item number 9, action to approve an agreement between Connington County and the South Dakota Department of Public Safety for a grant to update the current Connington County pre-disaster mitigation plan. And that information was in your packet as well. Anyone has any questions or comments from Cindy?
So this is just maybe the person more from the commission more familiar with it. This needs to take place every few years where you're updating it.
Yes, it's
mitigation
just,
plan.
we have to update it and,
Right.
Make a motion to approve.
I'll second.
all right, motion by Van Duzen, second by Gable. Any comments or questions on that? Hearing none, all in favor, say aye.
Aye.
Opposed, that motion carries. And then we also have action to approve a letter of agreement between Connington County and First District Local Association of Local Governments for the development of the Connington County pre-disaster mitigation plan, and they have helped us in the past as well through this process.
I'll make a motion to approve.
I'll second that.
Motion by Gable, second by Johnson. Any comments, questions?
So just so people know what we're doing, so we approved this grant, basically accepted this grant basically with our matching amounts, and then and we're gonna use First District as our basically consultant to help us do that. And all the amounts match up between the two agreements.
Any other comments or questions? Hearing none, all in favor, say aye.
Aye.
Any opposed? That motion carries. Item number 11, clarification on community health worker grant funding. We'll have Sarah come up and fill us all in on some items that came up after the meeting. Good morning, Sarah.
Hi, good morning, and I was not gonna I was just gonna share the information with you, and then I had so many questions over the last week about the position itself and things that I thought I just want to clarify a few things with that. And so I have this handy little handout that just is an overview of the grant, basically. What, I didn't send it.
Okay.
No, sorry. So it's an overview of the grant, and then I attached also the draft contract because we did get the draft contract for that, which is what you guys had approved. You had approved that, accepting that last week, and so, but I wanted you to be able to see the actual contract. So just an overview of this grant, which again, we had talked about last week, and you guys had approved the acceptance of it last week. Our target population is going to be Codington County residents who are high utilizers of the legal system, and that they have multiple risk factors happening in their lives, and they're not receiving significant support from other things such as drug court and that kind of thing. The goal is that we understand that a small number of our residents utilize a high percentage of our resources in the legal system. And so it will really be targeting that population to reduce the legal involvement and improve the health and general well-being through education and coordination of care and services. Some of the methods, and this is where I wanted to make sure you have some clarification. We're looking at a combination of some different models as kind of that coordinated reentry services, which attached you have a brochure from Sioux Falls regarding their Alliance program. And that's what a lot of what we do with this population for the reentry services will be based off of. We're working on the sheriff and the state's attorney and myself and Matt with the detention center going and meeting with the staff from Sioux Falls that provide this service so that we can adapt it to our community. So that will be the reentry services. And then because we're a smaller community, this person can work with a more like a different services. So some pretrial supervision, and that's what Becky with the state's attorney office really identified some help making sure that we have follow up and follow through for things like meeting with their attorney, doing the things that they're supposed to do during that period of time. And then just intensive case management for community members that are identified by the sheriff's department, people that they have a lot of interactions with, maybe haven't taken that step to have legal involvement, but are having involvement with the deputies and that kind of thing. I'm gonna work with Lee on the evaluation model. These were the things that were identified in the goal. Nights in the detention center, follow through with meeting and appointments, and follow through with community service providers. Part of that evaluation will also be participant feedback. So we'll look at the numbers, but we're also gonna look at the impact that we have on the individuals. And is it really making a difference? Because we know it's a small number of people, we wanna see the impact it has on their lives individually. And then the other part which came up after the meeting was that the grant does cover up to $88,108 basically of the employee costs starting February 1st through May 31st. They did move that date back from January 1st to February 1st, which obviously makes sense since we're in February. And however, the county is responsible for the paid time off, which is the vacation, sick leave, and holiday pay. I calculated that. And so that would be approximately 36 days of time potentially that the county would be responsible for covering because the grant won't cover that cost, which would be approximately probably a maximum of around $8,100 for that piece of it. So that's just for your information, that's kind of where the grant piece is at. Also, just so you know, I want you to know too, I am taking this serious. I'm not like jumping in thinking it's not a big deal for this to happen. In order for us to be able to eligible to apply for this, I had to complete an online training, and it was about a 10-hour training that has all kinds of resources and materials. I've also been doing some looking into what are some effective pre-trial programs and things like that, so that whatever we do, it's based on an effective model and not just what we're pulling out of the air with that. So those are some of those things.
So, actually, so the thing, the state stipulation about this is that we hire one of the community health workers to do this and kind of develop that program, right? I mean, that's kind of what's going on, where this grant came from.
Right,
So,
right. The other piece of that I should point that out, Lee, because this is a state grant, the Department of Health has gotten this federal funds to expand the community health worker. So the goal from that grant is to have approximately, I think it was like up to 300 community health workers in the next 2 years. So you're going to see this position coming all over the place. And the difference is what that position is targeting. So I know we just got notice yesterday, Stanford hired a community health worker. They will be working with the Stanford clinic population. And so that's why really looking at our targeted population is county utilizers, and their population will be people in their clinic doing. So it's similar to like social workers are everywhere, but we all do very different things. And so that's similar to what the community health worker will do also.
so yeah. So it's a different kind of a program. It's not,
Yes.
it's not just so this is kind of a new thing, and we're going to see if this kind of a thing fits with this kind of, I mean, this is, I think the job description and what your grant application, I mean, that's, I think it's well written. It's meant to, it would meet a need that we have, with all the transitional, people coming out of the criminal justice system and trying to help them out basically. So, yeah, where I was going with that now, but I lost my train of thought. But in any event, yeah, yeah, I think it's a good thing, but we do have to kind of keep in mind that it is kind of experimental. We don't know what's going to happen with once this year is done, or the
Right.
first 15 months is done. So.
And that is in the job description, that they are fully aware that it is a temporary at this time, just pending, Also, so the amount, the time paid off, you also are reimbursed some dollars for supervising this individual, which will be put back into the general fund.
Right.
Do you have any idea kind of so that could offset this amount?
Yeah, it definitely could. So the budgeted amount in the grant for my supervision and participation is, let's see, there's an amount in here, I want to say. No, of course I can't. Oh, 2,400.
So
It would offset some of it.
That was one thing that I had heard, you talked about it being possibly a temporary position. And that was one concern that I had, a person that qualifies to apply for this, but she really wants to apply, but she's afraid that she'd give up a good job now to take on this position and only have it be temporary. So,
and I had that same concern as well, who are we going to get? But doing a little research on this, I've come to realize that individuals in this area are used to this. So they kind of go from grant to grant. That's just kind of what they do. They further their experience and stuff by doing this. So they go into this fully knowing, and that happens all the time.
obviously our intent is to keep the position
We
if it's
hope.
working,
Yeah,
right?
we
And not to eliminate it after the grant runs.
But
That's what I mean, it may turn out to be a really, it'll be a little bit hard to quantify. I think, how much does it save out of the criminal justice system, but it could turn out to be something very beneficial.
Are we going to be able to have a good idea about the effectiveness of the program after that amount of time? you think?
Well, that's why I want to work with Lee to get it started right away.
Mhm.
So that we're tracking
track.
from the start on what it is, because I think that's going to be our biggest challenge. I mean, 15 months
It's
isn't
not long.
Yeah.
that long. And so we really need to be able to show, and that's where the numbers may not reflect it. We'll have to rely somewhat on personal
Mhm.
Yeah.
impact. with
Is,
that.
then the other question, just to make sure, as we're talking about hiring somebody, is a stipulation of the grant that it has to be a CHW certified person that graduated from one of our 4 techs. Is that kind of the idea, or?
Well, so that's actually a really good question, because I had some conversations with Heidi Wirchis over at Lake Area Tech, who was the one that ran the program. She's in a more of an administrative role now. But she informed me that individuals that graduated from the Human Service Tech Juvenile Justice Program, which might actually be a really good fit, actually have taken all of the CHW coursework. So they're not certified CHWs, but they would qualify under the grant. If we wanted to bill Medicaid, they would have to be certified. But if we're not billing Medicaid, we don't actually have to have a certified CHW, but we'll need somebody that's completed the coursework. So that does open up the pool a little bit of who would be eligible.
Wouldn't it be our advantage to bill Medicaid for some of these things or not necessarily?
No, because you would have to go through all the hoops
Okay.
of billing. I mean, like, so the hospitals and the clinics and the Human Service Agency where they already have that in place, they can bill, but you can only bill. It's kind of a,
Right. I know Transit does some of that with some of their
Yeah.
rides, but.
yeah,
okay.
it gets into a bit of a nightmare to
Yeah.
have that.
Especially short term, maybe
Yeah.
future, might be
Right.
something you look at, but
Right.
short term.
So these workers are kind of a hybrid, and I'm wondering, as far as the bookkeeping part of it, they're an independent contractor, but also receive vacation pay and sick leave, and how is that gonna affect the employment end of it here in the county? Cindy, is there questions there that you need to have answered, or?
I guess
Yeah.
part of my question is how are invoices going to be submitted to the Department of Health? How are we going to get our funding for the payroll part of it?
And so first, they're not actually independent contractors. The county will hire them as an employee. And so they will be a county employee for the duration of the grant. And then if the county continues to do that, that would be all.
If I can interject, it's kind of weird how the state does these contracts. They call the county the consultant.
Yep.
And that's
Oh.
kind of confusing. They do that for the nurse as well. So I'm not sure why they use that term, but
Yeah,
would you?
On page 8, I noticed a typo. I'll just tell you about it now so it can be corrected. So it's not missed, but
okay.
Brenda's email address is wrong on there.
Oh,
So
thank you. I'll get that.
it's just misspelled. No big deal.
So there will be a monthly invoice that we'll send in, and they have a form, a document that they send us and it says in there, I think it has to be submitted by the 10th of the month. And
Who's
so,
responsible for that?
well, I'm assuming I would be, and I mean, we can talk it through, but I was assuming that would be my responsibility to do that. I'm fine with that if you're fine with that.
And then the funding comes back into general.
General fund.
So that's,
It can go and then it can become an automatic supplement. to
Into her
Sarah's
budget, kind of like a pass
Because
through.
it's grant funding.
Okay.
yes, It's not anticipated.
That's what I was gonna say, because we'll have to reimburse her budget
Mhm.
for paying that
mhm.
salary out of there.
Yeah.
Okay. All right, so I guess we're looking, it's just information today.
It was just to clarify the part that did not get brought
Mhm.
forth or was omitted about the holiday and vacation pay. That's what the clarification was for,
Yeah,
because that was not noted last week.
Right.
right.
You
So,
accepted the grant award.
So
It's
what's,
just an oversight.
yeah.
Yeah.
So with that, then we could move on to item number 12, action to approve a job description for the community health worker position. So if you've all had a chance to kind of look that over.
and I did attach it there too. I didn't know if you would have it in your things. One of the things I do want to point out is we're actually calling it a community care coordinator, just to clarify a little bit that this is different than the clinic setting. It's more community-based setting.
Make a motion to approve.
I'll second.
Motion by Van Duzen, second by Gable. Any questions or comments on any of this?
was trying to pull it up on. So people could see what
Yeah,
we're talking about, but we're talking about the job description that's
Yes.
gonna
Right.
go with this grant.
Right,
So,
right.
so the actual, what's this person gonna be doing?
Like community care. That's what it will be called. Community care coordinator. So then you'll start if this is approved, start the hiring process.
Right, we'll get the job description posted and
And where, that was another question I had. Where is that going to be posted and how do people find it?
that's a good question. So Natalie and I had briefly talked about it, whether she'll do Indeed again. I guess the typical places where she
Post
probably
it on the
posts
county
it.
website?
Yeah,
County
county
website.
website, Indeed, and does she do
Job
Department of
service,
Labor?
I think she does that.
Department of
We've
Labor.
also advertised in the local newspaper.
Okay.
That's traditionally
Mhm.
the
The
the outlets. I
outlets.
don't-
Mhm.
Yeah,
So if
I
you're
would say we,
interested, watch for it.
Yeah.
I would say we
Maybe
should
coming out.
continue doing what we typically do with all the other ones. So it's not
Okay.
confusing.
Okay, thank you.
Thank you.
All right, any
Questions
other
about the position?
questions or comments?
I suppose you want to hire ASP, right?
I'd like to because the grant is limited, time limited.
It isn't 15 months after starting date, it's 15 months from February 1, right?
Mhm,
Till May 31st, 2023.
that's it.
Mhm.
All right,
I
you
have a
ready to
motion.
vote?
Yeah.
All in favor, say aye.
Aye.
Aye. Any opposed? That motion carries. All
Good luck.
right,
Thank you all very
Get it
much.
filled.
Thank you.
Thanks, Sarah.
All
Thanks.
right,
All right. See you next week again.
all right.
probably. Item number 13, action to approve abatement applications.
There are none today, but I'm going to leave that on the agenda because this is the time of year when those things
They
pop
keep
up and I want to make sure we can get them processed in a timely manner.
Sounds good. Action to approve claims for payment.
Nothing for 14 through 17.
All right, public notices. I just want to make a correction. The Winter Farm Show is the 9th through the 12th, not the 8th. Is there any other public notices that anyone can think of that there could be?
For GOP meeting tomorrow?
Yes. That. There will be, well, that will be, we'll mention that next week. Not to confuse things. Other than that, I don't have anything else that there could possibly be a quorum at unless someone else has something. Any old business? Any new business? Anything for the open?
I don't know if it's for, I got a annual report from the catastrophic, we participated in that program and.
Legal or health?
Legal Defense Fund.
Is that the legal
No,
one?
this is poor relief.
Health.
This is
Okay.
poor relief.
Okay.
Yep.
And our contribution will not change. I think that's, it's the same as it was last year, isn't it?
$2,837. I would have to look. I don't
Yeah.
recall what we paid
Yeah.
last year.
And it's kind of ironic, the balance in the portfolio of that account is exactly the same this year as it was a year ago. It ended up just ironic that it's the same. So, but we haven't gained anything, we haven't lost anything.
So there must not have been any cases or something. then.
Myron, is there anything new from the South Dakota retirement system?
South Dakota retirement system, other than the fact that July 1, everyone's gonna get a 3.5% pay increase, and we're just all sitting back holding our breath the way this market has been going.
Mhm.
For next year is gonna be the iffy, it's gonna be the one where we may have to tighten up our bootstraps. So other than that, no, it's over 100% fully funded, so
Good.
thank goodness for that. We're in good shape.
Anything else for the open?
Just watching House Bill 1053, I believe, which is from Representative Otten of Lincoln County. Kind of similar to the bill we've done before for the half-cent sales tax, to be able to where counties could ask voters, so we'd have another choice instead of just property tax when we have to build a thing, such as a jail. And so the advantage of sales tax in a lot of counties, it would save a lot of money. In the case of Representative Otten's bill, though, it's not a half cent, it's up to a whole cent.
Mhm.
So that would even speed it up more, saving even more financing costs. So you're talking, for the cost of a jail, millions of dollars, you'd have it paid off very quickly as opposed to having 20 years of property tax. So that's when we're watching in the House right now. It's still in committee. It got deferred from last week to this Thursday. So.
And with that, they did change it. It was a broader, they've removed some of the items that you can use
Yeah,
the
there was
dollars
some,
on.
they had
So they have,
roads, they had some
they
road,
took that out.
road stuff in there. And also I think they added in a what they call a cooling off period. So if
Yes.
a county did that, they would, and you pay for your piece of infrastructure, you're done, then you couldn't do it again for another 5 years. So a 5-year cooling off period.
That 1% increase would go across the board, wouldn't it?
Yeah, it'd be, so you wouldn't pick on property owners, you'd pick, so everybody would contribute. So
Correct.
that's
So
kind
the
of.
poor person that's getting $48 in food stamps a month to live on is also gonna have to kick in an extra $1 or 50 cents on their food
Yeah.
purchase.
Well,
whatever they buy.
and that's something to take into
So they
consideration.
can go with so if they're eating over at their kids' right now to make things stretch, it's even gonna be more of a hardness on them.
That's, and I think what's interesting about it, I mean, the way this bill and the bills have been put forth in the past is, it doesn't really talk about that issue. It's just, what's going to save the taxpayers the most money. And so that's and so it offers a tool to counties. So you don't have to do it. You can stick with property tax.
It doesn't lower property taxes.
No,
It's just
well,
a new tax.
it would provide an alternative to raising property
It
tax.
doesn't say anything about lowering taxes, Lee.
No, okay, you understand how it works.
Yes, I
Commissioner
do.
Walker.
I fully
Okay, when you-
understand
when
how
you-
it works.
when you
It's an
build
increase
something-
in tax.
When you build something, you have to go to your voters. That's right. Yeah, and that's the same
I totally
thing.
understand that.
It's the same thing.
and this, okay, so yeah, we're probably
a
gonna
new
have to,
tax.
we're gonna have to agree to disagree, but the thing is, this would sunset also, so it wouldn't stay on into eternity. It would come back off. So,
Yeah, it's just like any other, bond measure,
Right.
except it's a question of where do you want the tax to come from? Do you want it to be on people's property tax?
right,
Or do you want it to be sales tax?
Yeah,
So
and then it's
and
across the
nobody
board.
likes taxes, so you have to make an evaluation as a county.
And it is,
Um,
it would still need to be voter approved. So this is something
Yeah.
that you would have to bring
Yeah,
to a
right.
vote of
Yeah, in
your
fact-
constituents in your area. So,
In fact, property tax, I mean, in this county, we've asked our voters, do you approve of that or not? And so we've had some bond measures fail. And so the property taxes have not gone up to cover a piece of infrastructure. But what's nice about both of these, the measures we've been talking about is you have to go to the voters. Property tax, you don't always have to, but it's referable.
Yeah.
So,
it's always referable. Everything is. All right, then I don't believe we have a need to go into executive session. So I look for a motion to adjourn.
So move.
Second.
Motion by Johnson, second by Van Duzen. All in favor, say aye.
Hi,
Aye. Opposed? That motion carries.
thanks, everyone. Have a great
Yep,
week.
thanks, everyone. Have a good week.
You fully understand.
well, I mean, so would you rather have property tax and property tax or sales?
Isn't that an emergency?
What? Seriously?